Welcome back to the Pink Couch series. I'm Dr. Elizabeth Arguelles. I'm a board-certified breast surgeon at Southwest Florida Breast Surgery. Today, I'm joined by Dr. Dr. Shumadine, a board-certified radiation oncologist from Genesis Care. And today, we're going to be talking a little bit about male breast cancer. So clearly, people know that women get breast cancer, but men can get breast cancer too. About 1 in 1,000 cases of breast cancer happens in men. Not all men are equal risk. Men who have a family history of breast cancer or who have genetic predisposition to getting breast cancer have a higher risk. Men who are obese or who have enlargement of their breast can be at higher risk too. Men should be examining their breast and looking for lumps or changes in the nipple, bloody discharge, just like women, and report changes to their doctor. What most people don't know is that male breast cancer can be treated surgically just like female breast cancer. But Dr. Shumadine, is there any difference in the treatment for radiation because the patients are men?
So a lot of the data that we have is for how to treat male breast cancer is extrapolated from what we already know for treating women with breast cancer. And with that, there is the same role and indications for doing radiation after surgery, chemotherapy, as well as the adjuvant hormonal therapy that's given as well, all for men.
So because men tend to have less breast tissue and less breast mass than women, is there anything special that you need to do in terms of radiation when you treat a man?
So the vast majority of men end up getting a mastectomy, obviously, for breast cancer. And then if radiation is indicated based on the initial size as well as lymph node status, certainly there's some concerns. You still have to remain off the heart, especially left-sided. That's the biggest concern, is staying off the heart. For that, there's deep inspiratory breath hold. There's different surface contour techniques and surface tracking to monitor breathing while being treated.
So I think that a lot of men are very active in sports and physically active. Are there any concerns in terms of will the radiation decrease their strength or cause any other side effects, or are there any other technologies that you can use to try and decrease these side effects for men?
So, the key is to actually use CT-based planning and the new machines that we have to not only track the breathing of the patient, but also just to minimize the amount of radiation to the adjacent lung tissue, which is just below the rib, if you will, when you're treating the chest wall region. The pectoralis muscle, the chest muscle that men would use for strength, for various techniques like pushing up, that muscle, unfortunately, it needs to be within the treatment, what we treat for radiation, simply because the lymphatic drainage that goes from the breast and skin to the axillary lymph node area travels through that muscle. And so unfortunately, the muscle has to be treated, which can result in some degree of scar tissue, fibrosis afterwards. But certainly we try to minimize the radiation to other areas such as beneath the rib, to include the lung as well as the heart.
I think that the key to remember is that men should be vigilant. They should be checking their chests. And if they do develop breast cancer, it can be treated. And if they develop a side effect, we can always send them to physical therapy, just like we do for women, to help them regain their strength and mobility back so that they can heal and be whole again. Thank you so much for joining me today, Dr. Shumadine. It's a pleasure to work with you, and I hope you stay tuned and follow us again at the next Pink Couch series.